News. In today's Better Bodies report, a deadly disease. It makes thousands of women its victim every year. It can be almost always cured. About 77,000 women each year, in fact, are diagnosed with a gynecological cancer. Still, most are unaware of the symptoms or their risk of developing one.
Who do you think that is?
George Washington.
Who's that?
Abraham Lincoln.
Kathy Bowers reads to her students, hoping it will inspire a love for books. She hopes her own story will inspire women to learn more about the most deadly GYN cancer.
I think that women should know that ovarian cancer does kill over 15,000 women in the United States every year. It is the fifth leading cause of cancer deaths in the United States of women.
Kathy's doctor, Stephen Buckley, a St. Vincent's gynecologic oncologist, says the symptoms of ovarian cancer, like abdominal fullness or bloating, and sudden and persistent changes in bowel habits, are usually caused by more common problems, so they can easily be overlooked.
If they have those symptoms persistently and no one has mentioned or looked at their ovaries, then I think it's time for them to say, what about ovarian cancer? And I think that women have to be persistent. They, most of the time, tend to know their body better than anybody else.
A woman's risk of developing ovarian cancer increases with age, a family history of breast or ovarian cancer, and if they've never had children. Still, like Kathy, women can get ovarian cancer without having these risk factors, so early diagnosis is key.
In patients who have cancers that are diagnosed in the earliest stage, stage 1, in many times the cure rate is in excess of 90%. With ovarian cancers that have been diagnosed in advanced stages, that cure rate can fall to as low as 20 to 25% at 5 years.
Kathy's cancer was caught during a routine ultrasound, but not before it had spread to her lymph nodes. She had surgery followed by 6 months of chemotherapy. She's cancer-free now, but is followed regularly to make sure that cancer does not return. Wow. Well, the other two main GYN cancers are uterine and cervical cancer. Uterine cancer is the most common, but is usually caught early, and cervical cancer is almost entirely preventable. So here to talk with us more about it is Dr. Stephen Buckley, the man you just saw in that piece. Good morning to you.
Hi.
We talked about some of the symptoms, the vague symptoms at that, of ovarian cancer,
right,
the fullness and the bloating. What are some of the symptoms for uterine cancer and cervical?
Well, uterine cancer, fortunately, will oftentimes cause early symptoms of vaginal bleeding in women who shouldn't be having bleeding. You know, someone who's postmenopausal or irregular bleeding in a woman who's already having menses. So that's good, and most women seek attention, and therefore it is caught in its earliest stages many times.
And what about cervical cancer?
Cervical cancer doesn't often have early symptoms, but some of the symptoms with cervical cancer can be bleeding, pain, abnormal discharge, and things like that.
But as you mentioned, cervical cancer entirely preventable with the almost foolproof test, the pap smear.
Exactly, and you know, cervical cancer should be a preventable disease because, with pap smear screening, and but it is still not, and that's a big problem, is still routine screening of women with pap smear.
Much has been made about that vaccine that recently came on the market, the human papillomavirus vaccine. Can that prevent all cervical cancers?
That's a great question. It can't prevent all cervical cancers. It certainly will go a long way in preventing many cancers, especially in third world countries where you can't do regular pap smear screening. But the HPV vaccine is really only against 4 different types of HPV, 2 of the most common ones that cause cervical cancer. So it won't eliminate all cervical cancer.
But let's talk about who can get that HPV, because from what I'm understanding, that vaccine must be administered to a person before they actually start having intercourse.
Right. The target group is young girls, or girls from the ages of 11 to 13. The vaccine can be administered to women up to age 26.
What is your advice for women out there who, just this ovarian cancer business frightens me because the symptoms are so subtle and vague. What is your advice for a woman who's having some issues and maybe is not seeking the care of a doctor?
Well, I think that, the most important thing is knowledge and is, learning, what is right for your body. And women who do have, what woman in her mid-40s, early 50s doesn't have occasional bloating and things like that? So if symptoms are persistent, and like I said, women know their body best, and if they say, this isn't right for me, then they need to seek attention. And sometimes it requires, directing the care and saying, look, I really think we need to go the next step to look at something.
Thank you, Dr. Buckley. And
thank you.
As he mentioned, the survival outlook good if you catch it early. So if anybody out there is listening and has these symptoms, please see a doctor. Thank you.
Thank you.
If you'd like some more information about gynecological cancers and their symptoms, call the nurses at St. Vincent's Health Link. The number is 308-LINK. Well, it's not the most exciting subject in the world, so one lawmaker decided to spice it up a bit.